A new case of the deadly coronavirus has been confirmed in the U.S.
Breaking news relating to the coronavirus.
Health officials have declared a public health emergency.
A study also showed the virus can be transmitted by patients with no symptoms.
Signs of infection include respiratory symptoms.
Nearly 14,000 people worldwide have been infected.
Fever, the coronavirus outbreak, coughing and breathing difficulties.
A new study out by the British medical journal The Lancet estimates that more than 75,000 people have been infected by the virus as of last week.
Can cause pneumonia and even kidney failure.
More than 50 million people are still on lockdown and unable to travel.
With no vaccine, humans don't have immunity, and the virus could mutate, so it's hard to control.
Tonight, the latest battle to contain the coronavirus being fought in Massachusetts.
The World Health Organization declared a global health emergency.
There have now been confirmed cases of the disease in more than 20 countries across the world.
A woman who traveled from Shanghai to Germany infected 7 other people while she remained asymptomatic.
They check everybody's temperature and make sure you're not having fever.
This quarantine is the first of its kind in half a century.
On Monday, a man was rushed from his home in Birmingham to hospital by medics in biohazard suits after displaying symptoms.
I worry every second that something bad will happen and I cannot help my child.
The world is still learning about this new coronavirus, which is rapidly spreading by the day.
The coronavirus death toll rises.
The official line is not to panic.
Health experts say the risk to the general public is low.
Hello, it's another video. It's Tuesday again. I wanted to do something about like health anxiety, and I know that freaking intro is scary. Like sitting watching it back when I was putting it together and taking the different clips from different news sources, like it's crazy the amount of attention that this new coronavirus is getting. And like, yes, there is a trigger warning at the start of this video because we're talking about health and we're talking about like what effect does that kind of press coverage have on somebody that is already maybe struggling with health anxiety. And that's what I wanted to talk about. Like, how does that affect you? I'm asking you this week a question on your thoughts on coronavirus or the flu or anything like that. Like, is there somebody near to you? There was somebody in one of those clips that was tested for coronavirus in Birmingham, which is 20 minutes away from where I live. Like, there are 2 cases in the UK at the moment. I mean, before this video gets uploaded, it could be 50. But they were in the north of England, so there's nobody like within a hour, 2-3 hour radius of where I am right now with it. But it's just spreading. Like, the numbers are staggering. It's like over 350 people dead now, majority of them in China. But it's scary, especially when you see it on the news and you see it on the TV constantly. It's all people are talking about on social media. It's like forecasting how many people are going to fall ill with it, how many people are going to die from it. And it's scary, especially when we're here, I say we being people that struggle with health anxiety, like we're just sitting here and when we sneeze, we're thinking, is it something more sinister? Or when we get a pain or anything like that. So the thought of getting anything that has been hyped up as much as this is, like as far as I'm aware, and so I'm led to believe, like we're not being told the whole truth about how many people are being struck by this. So I don't know. Like, how do you feel about it? Is the coronavirus something that you're worried about? Is it making you more conscious of your health? Are you washing your hands more? Have you got a mask? Are you going out? Are you being in public places? Like, has it had any effect on you? And does it? Because this is a real thing. I mean, the thing for me, like, I try to use rational thinking when it comes to stuff like this. Like, yes, there's a chance that I could get it. There's a chance that you could get it. But there's a chance that we could also get something else, like the flu. And like how many people die from the flu each year? It's in the tens of thousands. Like, and maybe we could reach those numbers with this. But like, it's no more threatening, I don't think, is it? I mean, the people that I assume are more vulnerable to this are people with pre-existing conditions like diabetes or some other organ failure or just a poor immune system, perhaps. I'm not a doctor, you might have noticed. And old people, maybe children. So, like, I'm none of those. I'm not old yet. But, you know, this kind of thing, it happens, doesn't it? We see it. We've seen it with Ebola. We've seen it with SARS. And then you get all this press coverage and you start to question, like, what if? What if I get that? Or what if this happens? Or what if somebody gets it that I know or that I'm close to, or I've maybe in a week's time it comes out that somebody has the coronavirus and they were in the same friggin' supermarket as me. But it's not going to be me because I haven't been to the supermarket. But like, is in a weird kind of warped way, being stuck at home is probably the best thing at the moment. Like isolation, quarantine. It scares me, it does scare me, the thought like of my daughter coming home from school with a cold. I'm going to be questioning, like she's going to be stuck in her room for at least 2 weeks. But yeah, that's what I was thinking about this week, because it's all I've seen to have been faced with is just coronavirus. Every time I put the TV on, the news is about the coronavirus. Bird flu, do you remember the bird flu thing? Swine flu was another one. Like, I was pretty nervous about swine flu, I remember it. But now countries are putting up like millions. I know the UK is putting up 20 million to try and help research into a vaccine for it. So I'm not really nervous about this like taking over and becoming an issue for everybody. I mean, yes, there's going to be, I would imagine, plenty more people that suffer from the coronavirus. There's going to be many more fatalities from it, I can imagine. And it's a sad, sad situation. But there's nothing that we can really do about it. I mean, other than staying hygienic, washing our hands and being alert, and I don't know. This is a bit of a pointless video, other than the thought of me asking you a question as to whether the news on the coronavirus is having any kind of effect on your health anxiety. And if it is, what can you do to try and like rationalize it, to try and not be so alarmed by the outbreak that is continuing to spread across the world at the moment? I mean, for me, the way that I deal with this kind of thing is to just be rational about it and think, like, what are the chances of me getting this virus? I mean, they must be almost non-existent. Like, I don't go out of the house that often. When I do, it's to take my daughter to school or my girlfriend to work, as you know. I'm not in public places. There's nobody in this area that has been reported with it. And even if there was, like, I have no connection to anybody other than the 2 people that are in this house at the same time as me. So I'm not too concerned about it. I mean, there obviously is a chance that my girlfriend could be at work and somebody may have come back from China or been in the same friggin' supermarket or hotel as somebody that's got it. Like, it's possible. But it's not likely. And that's where I tend to fall on the side of, like, let's stick to the facts. The facts are that only 2 people so far in the UK have been struck down with this. 2 people out of what? Is it 70 odd million people in the UK, I think? So, you know, I'd say I'm in with a decent chance of not picking up the coronavirus. And I would say, hopefully, if you're watching this video, and you're watching it because you are struggling with health anxiety, especially around the time of this happening, like, just know that the chances of you getting this, if you're careful and you don't, like, walk around licking lampposts, then you're going to be fine. And I don't know why I said licking lampposts, but it's just like hygiene, isn't it? Wash your hands. If you use a tissue, put it in the bin. Don't drink from the same bottles as people. Like, carry some hand sanitizer around with you. I know, like, face masks and stuff are selling out in the UK because of this, and I'm pretty sure the same sort of thing happened when swine flu was around, because that was big news a few years ago. I remember being alarmed about that. But this time, I don't know, maybe I'm just a bit wiser, a bit more mature, and I just don't think, like, this is something that's going to take me. It might, and I might regret saying that. But, like, there's probably more of a chance of me catching the normal flu, like seasonal flu, than there is this. So that's what I'm more concerned about, like just being hygienic. Wash your hands. If someone's got a cold, don't let them blow their nose and leave the tissues shoved down the side of the sofa, you know? Just precautions, I guess. Prevention is better than cure. So, I don't know. It's a bit of a weird video. I enjoyed putting that intro together, like the amount of news coverage that is being put on the coronavirus. Like, it's no surprise to me that people might be freaking out about this. And I guess this time around that we've got this global epidemic, this time around I'm being a bit more sensible with it, and I'm not just jumping to the conclusion that, right, it's out there, I'm going to get it. Because there's been a lot of these bugs going around, like throughout the world, we hear of this stuff, and like, thankfully, I haven't caught any of them yet, so I don't see why I would be this time. Like, I don't freaking go out that often anyway. So, if you're struggling with it, switch off the TV, switch off the news, don't watch this video again because the intro will trigger you, and, I don't know, just get on with what you were doing. Just get on with your normal life, get out, do something positive, just not licking lampposts. That's pretty much it from this week. If you haven't already, subscribe, like the video. If you like the intro, like, just let me know, because it took me a good 20 minutes to put them clips together. But yeah, I don't know, off topic, on topic, I'm not sure. I just thought to myself this morning, like, coronavirus, I keep hearing about it, I keep seeing it, I've said it about 300 times in this video. Like, how is everybody else feeling about it? Is anybody triggered by the thought of the coronavirus? And what are you doing to keep yourself safe? Like, hopefully not too much, because we don't need to be unrealistic in our expectations here. Like, let's just turn off the TVs, let's not watch the news, we don't need to learn anymore, we just need to make sure that we're being hygienic, looking after ourselves, as we should always do. And hopefully, fingers crossed, we'll all be sound. I'll see you next week then.